Questions with Bob and Craig. I'm Dr. Bob Becker.
I am Dr. Craig Scott, and today we're going to go over a few of the commonly asked questions in orthodontics. Why don't you go ahead and draw one there, Bob, and see what we have.
Okay. All right. At what age should I think about bringing my child to see the orthodontist?
Great question, Bob. The American Association of Orthodontists recommends that every child be seen by age 7. A lot of times we don't do anything at age 7. Sometimes we're monitoring growth, we're checking the teeth that have come in, checking teeth that haven't come in yet on an x-ray. So it's good to see the child early, and in the event that we need to do something, we can do it early, or we continue to see them until they are ready for treatment. Sometimes that could be as late as 11 or 12 years old.
Okay. Let's see. What is the definition of a moment force times distance from the center of rotation?
You just answered the question. You read the question and then answered it.
Okay, so much for that one.
Okay, go ahead, read it again.
Okay.
And then I will go ahead and answer it.
What is the definition of a moment?
A moment. A moment is force times distance from the center of rotation of the tooth. That's a great question. I wonder who sent that one in.
I wonder who sent that one out.
I don't know.
That was a good one.
We'll find out.
Must have been one
Maybe
of our
someday.
old professors.
It was probably one of our professors. Next question. Why should I see an orthodontist instead of ordering my clear aligners on the internet?
Oh, very good. So lots of TV commercials and so forth for aligner therapy over the internet, such as CareCorrect. So the difference is when a patient comes into us for aligner therapy, which in most cases for us it's Invisalign, but there's a lot of different aligner therapies out there. They come into our office, we do a thorough orthodontic examination. We take, if they're ready for treatment, we usually take diagnostic records, which is digital models, photographs, an x-ray, panoramic x-ray, and then a 3D scan. Off that 3D scan, we could take our cephalometric x-ray. Cephalometric x-ray is what we use to do measurements of jaw measurements, teeth angulation measurements. From that is what we use to treatment plan the case. And from there we can also decide, is aligner therapy the best or is braces the best treatment for this patient? Whereas if we're CareCorrect therapy, you basically take impressions at your home or you go to one of their scanning offices, get a scan done, they send that in, and they send you aligners from home to do. Basically, they do no attachments on the teeth. Attachments are tooth color bumps that we put on the tooth that allows the aligners to move the teeth in certain directions. You will not get that with a do-it-at-home type therapy. We monitor treatment all the way through. We'll see you back every 2 to 3 months during aligning with therapy just to make sure things are going correctly. Most of the time, digital orthodontics doesn't go as planned, so we have to take a step back, redirect things, and continue treatment. So that's the big difference, is it's monitored versus non-monitored.
Good answer.
Okay, I'll try not to answer the question this
Right.
time, okay?
Let me answer it.
How long will my first appointment take?
How long? Well, in our office, you call in for an appointment typically. We'll schedule for a time that's convenient for you and you'll come in to see us. You'll maybe fill out paperwork here or you can fill that out at home and send that in digitally. Either way, when you come to the office, you're here for about an hour. During that hour, Dr. Becker already mentioned several things that we do. We take orthodontic records, which would be a digital scan of the teeth. We also do a digital scan x-ray where we can actually send that in and have that read by a radiologist. We also take photos. And we do an initial exam where we actually look at the teeth and we make some notes. We talk to the patient and or the parent about that. And we go over everything that we see that needs to be fixed and how we can fix that. We answer any questions that you might have, and usually all that happens in about an hour.
Last question.
There's just one left. This is yours, okay. Dr. Becker, what is the focal film distance for a lateral cephalogram?
The focal distance for a lateral cephalogram is 5 feet or 60 inches. And I believe if you converted that into, what is it metric, Dr. Scott? What do you think for our metric users?
Is it, it's under 1,000 meters, isn't it?
I would think so.
Under 1,000 centimeters?
Yes,
Under 500?
probably.
I think it's 100, 124
point something,
It's a point something.
point something.
Point something's not.
For our
important.
metric users
Yeah,
out
for the
there.
metric users, 124.
So
point
the
something.
cephalometric X-ray, we used to take that on a certain machine that you had to be 5 feet from the actual distance of the cone. But we really don't use that anymore since we have a 3D imaging system. We just pull the cephalometric X-ray off of that. So that's kind of old school stuff.
So that question might have been from an old school
That might have been.
person. Okay. All right. Well, thank you for joining us for Questions with Bob and Craig. Again, I'm Dr. Craig Scott,
Dr. Bob Becker.
and we'll see you next time.